My name is Dr. Sarwar Chaudhry and we're going to talk about postnasal drip today. Postnasal drip is a slow trickle of secretion from the back of your nose into your throat, and it can give you a few symptoms. The most common symptoms among that is a constant feeling of something sticky in the back of your nose or in your throat, a sore throat, constant need to cough, constant need to clear your throat, change in the voice, but also importantly the symptoms of runny nose or congestion in the nose, congestion in the sinuses, pain in the face or headache. So postnasal drip is not an uncommon problem. There can be many reasons for postnasal drip. One of the most common causes of postnasal drip is allergies of nose and sinuses. Other common and transient causes include infections, which most of the time are viral nose infection or flu-like symptoms or viral sinus infections. Sometimes these infections can be bacterial in nature. Among other causes are allergens in the air, like bad air quality or pollution, which can cause a postnasal drip. If there's any noxious agent in the environment, like working with certain chemicals or fumes or gases, can also cause that postnasal drip on a short and long-term basis. In children, we sometimes encounter postnasal drip as a cause of the constant cough, and occasionally that can be induced by foreign body stuck in the nose. Occasionally enlarged polyps because of persistent sinus inflammation, allergy or infection can be a reason. Certain medication can also cause stuffiness in the nose and postnasal drip. It is not uncommon to have postnasal drip in cold and dry weather too. Now, talking about the typical examination finding that we see is in a dry nose or congested nose on examination, obvious polyps on a nasal examination or nasal endoscopy, blockage of the tubes or opening of the sinuses, and inflammation in the throat. And sometimes we can see obvious trickling of postnasal drips. Most of the time this is a clinical diagnosis and we can figure out what may be causing the problem. If we are unsure, we may need to run some tests for general well-being, but also test for the allergies. Occasionally we may need to do a scan or imaging of the sinuses to see how things are happening or how much inflammation is there. Talking about treatment, it depends on the cause. If it's a viral infection or bacterial infection, we may need to just wait till the infection settles. In the meantime, we can use some saline nasal spray to help with your symptoms. If it's an allergic rhinitis which is causing postnasal drip, we may need to give you some nasal steroids which slow down or reduce the inflammation in the nasal cavity and sinuses, along with reduction in the size of the polyps, and reduce your postnasal drip symptoms. If there is a foreign body, especially in case of children, if it's a suspected unilateral persistent nasal blockage, we may need to do proper nasal endoscopy, and if there's any foreign body, that needs to be removed. If someone has to work with a chemical or irritant, using a proper respiratory protection using P2 mask may be what is required to reduce the symptoms. Sometimes it is important to remove the stimulus altogether, which is more true of general allergies like hay fever, where there is a persistent allergic reactions in the nose and sinuses and causing postnasal drip. If you could avoid strong exposure to the pollens or other allergen which may be causing that, could help your symptoms. So if you are worried about postnasal drip as a constant nuisance causing you the symptoms as we discussed above, you should consult your nearest physician or pulmonologist or immunologist to assess the symptoms and do appropriate investigations as required, followed by treatment.